Hi, honey. How was your day?
Good. I got home from work early today.
Good. Any mail?
I'll say. We got a bill for $195 from the medical center, and it says we're past due.
Well, that's not possible. We've never been past due on a bill. I wish they'd get their facts right.
I don't know, but the way I read it, the insurance company only paid 80%, and now we're supposed to come up with the rest.
For what? I don't even remember what I was there for. Well, if you ask me, this is just another example of the outrageous price of medical care. I'm going to call them tomorrow and give them a piece of my mind.
Sounds like trouble. We've all handled patients like this, and many times felt frustrated with our inability to satisfy them once they become angry or upset. And the challenge is growing. That's because more employers are shifting a larger portion of health benefits costs to their employees in an effort to reduce health care expenses. Managed care insurance plans increasingly require higher co-payments, and deductibles now average more than $200 per person per year. Our studies indicate over 20% of hospital and clinic revenue comes directly from the patient. A few years ago, self-pay made up less than 10% net revenue. Unfortunately, patient receivables consume a disproportionate share of administrative time and expense. Part of the reason is that hospitals and medical practices are still learning to deal with the patient pay phenomenon. We can all agree on the potential cost effectiveness of collection at the time of service. No additional billing statements or computerized dunning statements would be required. No follow-up telephone calls. And, of course, no dollars tied up in our accounts receivable. But are we prepared to implement a procedure that most other businesses have long had in place? Can we ask patients to make payment arrangements at time of service without sacrificing good patient relations? The answer is yes. But you need to start with a solid foundation. One of the most important steps in this process is to be able to produce a bill when services are performed. How can we expect patients to pay for services if we can't present them with at least an estimated bill? Second, make paying for services accessible to patients. Don't ask patients to walk to the other end of your complex to pay. Avoid situations where patients must stand in long lines to see a cashier. Provide patients with a number of payment options. Educate your patients that payment for visits is expected at time of service. Post notices or signs stating your policy. In addition, educate your medical staff about your policy because they can influence its success or failure. Finally, you also must decide to what extent services will be available without payment at time of services. Will all services be provided whether payment is received or not? How important is co-payment compliance, even if it's only a few dollars? Decide these policies prior to implementing and set specific guidelines. Ensure everyone understands and follows these guidelines. Properly implemented, a time of service collection policy can be a win-win situation. The patient wins because they receive better service. Financial counseling and verification of insurance benefits is a real value-added patient service. They better understand and are more willing to pay their medical bills. They develop a greater satisfaction and confidence in the hospital or clinic. But you win too, perhaps more than you thought possible. More accounts are collected with less effort. The longer we wait to collect health care bills, the more difficult it becomes to convince the patient to pay. There is a significant impact on cash and efficiency. Patient pay revenue properly collected is an important contribution to the bottom line. Fewer complaints from patients. That's something we all want. In fact, our studies indicate that a properly implemented time of service policy can actually improve patient relations. The human relations aspects of time of service collections. Patient relations is a focus throughout the healthcare industry today. All of us must look at ourselves and honestly assess whether we're having a positive or negative impact on how our patients perceive our organization. Let's take a minute and see how one employee has an impact on the collection situation, and ultimately how the patient reacts.
Mr. Long, our new policy requires that we check to make sure your insurance benefits will cover your charges. Now, unfortunately, the plan you have doesn't cover this type of diagnostic test, so you will need to pay us $235 today.
It's impossible. My insurance has always paid 100%. Do you guys know how to file the claim? You seem to think money grows on trees.
Look, I don't like this any better than you do, but you have to pay today or reschedule the test. You decide.
Oh, you want me to decide, okay? I'll tell you what I've decided. I decided I'm never coming back here again.
You know, it didn't have to go like this. The cashier had a significant impact on how the situation was perceived, and ultimately how the patient reacted. Part of learning how to motivate others to pay is looking at specific words or phrases that will actually demotivate your patient. You may want to avoid phrases like, "I want you to," "I need," "we require," "our policy states." These phrases all make demands on your patients and are perceived negatively. For a better response, try, "Here are some options for you. Did you know you can? May I suggest?" Developing a positive patient service attitude when collecting medical bills at time of service will be a key to your success. The fact is, if you don't have excellent patient relations skills, your collections will suffer. Did you know poor customer-patient service is the #1 reason why you'll lose a patient to the competition? An average patient who was unhappy with the service at your facility will tell 9 other people. 1 out of 5 will tell 20 people. Your patients will pay faster when they receive better service. All of these facts lead to one important message. Excellent patient relations leads to improved collections for your office. Let's replay the scene we just observed, but this time the words, attitude, and office setting will be different.
Mr. Long, as a service to you, we contacted the National Health Alliance regarding your diagnostic procedures. They will be paying 80%, leaving a balance of $235.
That's impossible. My insurance company has always paid 100%. Do you guys know how to file the claim? You seem to think money grows on trees.
Many of our patients are surprised at these new coverage guidelines, and that's why we provide payment options. Would it be more convenient for you to pay with a check or a credit card?
Well, I suppose I could use my Visa. But what happens if my insurance company pays more?
I understand your concern, and that's why we're so careful when verifying your benefits. If there's any variance, we'll credit your account. But by paying today, you can forget about this bill and focus your energies on getting better. Let's take care of this paperwork and get you on your way.
It would be nice if they all went that well, and for some people they seem to. Here are a few tips that may improve your batting average. Know your job thoroughly. Performance has a top priority. Bad information is bad human relations. Credibility is key. Give clear and complete information. Try to avoid medical terms and use language and descriptions the other person can understand. Be objective and empathetic. Try to understand how a person feels, but maintain emotional detachment. Becoming angry when the other person is angry makes it impossible for you to produce the results desired. Make allowances for individual differences. No one pattern of doing things will work for all people. Adjustments in approach, in timing, and in speech will need to be made to suit the individual in any situation. Encourage the individual to comply willingly with regulations. Sometimes it's necessary to help the patient understand the reason for rules and their purpose. We may need to remind them that prompt payment allows your facility to keep costs lower. Avoid arguments. Winning is a great feeling, whether it's a baseball game or an argument. Unfortunately, the end result of winning an argument with a patient may be a costly public relations problem. Now, here are techniques for successful time of service collection. When it comes to time of service collections, we think it's essential that you have a fair and focused objective. Payment in full with cash, check, or credit card. Payment of patient portion or copay with cash, check, or credit card. Payment arrangement with pre-authorized credit card form for balances not paid by insurance. Bank finance program for larger balances. Solid and realistic payment agreement with supervisor's approval. The objectives are listed in order of preference. Keep in mind that we would prefer payment today. Other options are accommodations to help with real needs. Collecting face-to-face has some distinct advantages. In fact, the bottom line is that your chances of getting paid are better at the time of service than at any other point in the collection process. Be sure you use this opportunity effectively. If possible, hold the interview in a private area. All personal and financial information should be kept confidential, so you should not discuss this information in front of other patients. You and your interview office should look neat and clean. Remember how important it is to make a professional first impression. Introduce yourself and give your position at the start of the interview. This is a common business courtesy. Call the patient by name frequently during the interview. Have all pertinent account information in front of you. You don't want to be perceived as unprepared. Be alert to any physical discomfort or anxiety on the patient's part. Know what to do if medical needs arise. In addition, successful time of service collection techniques require salesmanship. Effective collectors know how to sell the concept of payment by implementing this three-step approach. Ask questions to better understand the situation. Overcome objections and motivate to pay. Offer alternatives and gain commitment. The ability to ask questions is essential to successful collections. Questions allow you to retain the initiative. Obviously, if you're asking the questions, you hold the right to establish the leader role. Similarly, the conversation will continue along the lines indicated by your questioning. Questions give you control. Once you discover an objection, you'll need to overcome it. Now, let's work on overcoming some of the objections you're likely to hear. Perhaps the most common during early implementation of a time of service collection policy is, "I've never been asked to pay before." Let's look at how this dental receptionist handles the situation.
Mrs. Jaeger, the professional fee for the root canal therapy Dr. Hardy performed is $525. Your insurance will cover all but $125. How will you be handling that?
I'll cross that bridge when I come to it. Just send me a statement.
Well, actually, I have your statement ready for you today. Do you recall we talked about the fee at your initial visit?
It's like I told you then. Dr. Hardy has never asked for his payment before insurance paid. You people seem awfully interested about money all of a sudden.
Actually, although we have changed some of our procedures recently, we've always encouraged our clients to pay for services as soon as possible. Well, now we've added an insurance verification system for you. We called Principal Mutual, and they've advised us of your exact coverage limits. If you take care of the bill today, you won't have to worry about it anymore. Doesn't that make sense?
I just don't get it. Prices continue to skyrocket, and you want your money sooner. Why can't you send me a statement? I like to look at everything at the end of the month, then decide how much I can send.
I understand, and I think I have some options for you. But you may be interested in knowing that payment today actually reduces the cost of health care. And I'm sure I don't need to tell you that sending out numerous statements adds to our costs. And waiting until after insurance pays to find out how much they cover can create a surprise that neither one of us is prepared to handle.
You're right about that. I got a statement from the medical center last month that was past due before I ever saw it. That really made me mad.
Exactly. And that's why we want you to know where you stand today. If you want to wait and pay with the rest of your bills, why not put it on your Visa or MasterCard?
I never thought about that.
The key to the collector's success was a calm, empathetic, but direct response to the patient's objection to payment. The receptionist effectively addressed Mrs. Yeager's concerns, but clearly stood her ground on the issue of payment. Many times, patients will take the action you want based solely on how you close the sale. Here are some simple rules to follow. Make sure you've uncovered and overcome every objection for payment. Patients won't pay unless you've taken care of their concerns over payment. Give at least one reason to pay the bill. Be sure to motivate action by giving a good reason for paying. Sell them on the benefits of taking action. Agree on the action to be taken. Set specific terms for payment. Make sure the other person knows exactly what you expect. Thank the patient. Let's watch how this emergency room cashier uses alternatives to overcome resistance to payment.
Well, Mrs. Sink, it looks like you're in a lot better shape than you were when you first came in. Let's see, today's treatment comes to $257. How did you want to handle that?
To tell you the truth, I don't want to handle it at all.
I understand your surprise, and excuse me if I seemed a bit matter-of-fact. Let me explain how we arrived at those charges.
Oh, I really don't see the need. If you call my employer, Dunkirk Furniture, they'll take care of my insurance. It's not as if they don't have the money.
Well, you're right. Dunkirk certainly has a great reputation, but we don't know if there's a deductible or co-payment, so we offer a variety of payment options. Then the insurance company can pay you directly.
Yeah, but I can't write out a check for $257.
Well, we also accept Visa or MasterCard. Which one would you prefer?
I might be near my limit, and my portion's only going to be a few dollars.
That's probably true. Here's another alternative. This Patient Easy Pay consent form authorizes only the amount not paid by your insurance.
You mean you would only charge my credit card after the insurance paid its portion?
That's right. All you need to do is fill out this Patient Easy Pay consent form.
Okay, that's fair.
Offering alternatives to cash. Over the last 2 years alone, Americans saw their out-of-pocket health care costs increase substantially. According to a recent nationwide poll, more than 2/3 of the 1,200 households surveyed believe that the self-pay portion of health care costs, notably insurance deductibles and co-payments, will continue to increase. American households currently spend about $1,500 per year on out-of-pocket health care expenses. Recognizing the sharp increase in out-of-pocket costs, major credit card companies have launched health care programs offering consumers and providers a convenient and flexible alternative payment mechanism to cash and checks. Research has shown that 73% of households have at least one major credit card or charge card, and they only use half of their credit limit. Perhaps more importantly, the same studies reveal that patients would be willing to utilize those cards for health care if asked to do so by the health care provider. But what about those patients who don't have a major credit card or who have an insufficient available balance to handle their portion of the bill? Several banks have geared up to provide loans to patients with a self-pay balance. In these programs, the hospital or clinic signs up the patient for the loan and ships the paperwork to the bank. The bank pays off the hospital at once and collects from the patient. If the patient defaults, the hospital must repay the bank. Interest rates and loan terms are based on the total amount borrowed. Let's look at how a bank finance program might help resolve a patient's concern over how to pay their bill.
Hello, Mr. Brill.
Ms. Kendall?
Yes, nice to meet you. Please have a seat. Okay, I've just got a few more papers for you to fill out, and then you can be on your way. Now, as Mrs. Sweeney advised when you were admitted, the co-payment on your insurance plan is 20%. Her estimate of your portion is $3,750. Now, the actual billing is slightly less. Your total is $3,655. Have you and your wife decided on how you'd like to handle that?
Wow, I haven't talked about much of anything else. To be perfectly candid, although we both have pretty good jobs, I'm a little embarrassed to admit that we don't have much savings, certainly not $3,600.
Right, I understand. I'm not certain any of us anticipate major medical expenses. We have developed a number of options that may help.
The admissions clerk said something about installments. We really do need some time.
Right. Mrs. Sweeney was referring to our bank finance program. Payments are made over a convenient period and mailed directly to the bank. How long did you want to carry this obligation?
I'd prefer to pay the hospital. You don't charge interest.
Well, yeah, actually, we can provide you with a short-term payment arrangement. Now, we would need 3 equal payments, 1 today and the other 2 at 30-day intervals. Would that help?
Not really. I guess I was thinking more like 100, 110 a month.
Oh, no problem. Our bank finance program offers competitive interest rates and will allow you up to 36 months based on your balance. Let's see, according to my calculations, your monthly payment based on a 36-month term would be $122.85. Well, that's about $28 a week. How does that sound?
Well, it'll be a stretch, but we can handle that.
Yeah, great. We appreciate your cooperation. You know, one side benefit of the program is that if you make your payments on time, you can develop an excellent credit rating with the bank. First, however, I'll need you to complete this credit application, right? You can use my pen there.
Did you notice that the financial counselor found a way to make this a win-win situation? She saw herself as the answer to the problem, rather than taking on the role of someone creating a problem for the patient. Goal setting and employee motivation. We've attempted to cover many of the techniques you'll need to become successful in time of service collections. Human relations, and how your attitude, words, and reaction to your patients will impact the collection situation. Specific techniques for collection, asking questions and developing an understanding of the patient perspective, motivating payment today by overcoming objections and providing alternatives, getting a commitment, completing payment or arrangements for payment. Finally, we talked about alternatives to cash. But we've left out an important aspect of time of service collections. Any implementation to be successful should include involving staff members in goal setting. This approach will develop teamwork, improve staff morale, and increase motivation. Best of all, it will produce results in lower days revenue outstanding. Goal setting done individually and as a group can be a guide to measuring your success. We suggest that at minimum you implement a tracking mechanism to monitor total dollars collected, credit card payments received, pre-authorization for payment, bank loan programs sold. All collections should be ranked against potential dollars collected, and, if possible, tracked individually as well as for the group. Then, as a group, develop goals to increase the percentage of actual dollars collected to potential dollars. Although your job is challenging, what you're doing is important. Tracking your progress and setting goals for improved performance is a tangible way to measure your contribution. Today, effective patient collections are critical to your facility's financial health and to patient satisfaction. The methods shown in this tape have been proven to work. Their implementation may take time, but the outcome will be improved receivables and personal satisfaction of a job well done.